Good evening, everyone. On behalf of Dr. KK's Heart Care Foundation of India, I welcome you to all to our 92nd weekly webinar. We've been doing this week on week with the whole purpose of raising awareness on different health issues amongst the youngest and the brightest minds and people who will kind of be the future of, the future generation. The whole idea is to make sure that these children have a very, very strong take home message. These children are engaged and we are able to kind of utilize the time that they have when they're at home, when they're not at school, when they're actually in that phase of wanting to learn different things and understand different things. And we also get a lot of queries coming in from parents, from teachers, from principals week on week on different things, and that's how we decide the topics going forward. So thank you so much for joining us. The topic for today is a very, very important one, and I really thank Dr. Turrell, for joining us to address this. It's spine care for children during online classes. This is something that everyone has asked about. Parents are very, very worried that children are sitting in front of screens. Children are kind of, their posture may not be right. What are the long-term impacts of, sort of sitting at home and homeschooling, literally by parents, by teachers, all digitally and all virtually. Children aren't exercising as much. They haven't been going out in parks. We can see right now also, right? Most people are sitting with their backs bent, with their necks bent. They're not sitting in the right posture on a table. So what impact does that have? And that's something that we're going to be addressing today. But before anything else, I would really like to extend a warm welcome to my co-hosts for today. Mrs. Shalini Arora, Principal Veda Vyas, DAV Public School, Vikaspuri, Mrs. Rajbir
Thank
Kaur,
you.
DAV Public School, Rohini, and Mrs. Bhavna Arora, Academic Counselor, Little Flowers International School. I would really, I'm very grateful to all of you for supporting us and for agreeing to do this and for continuing to support Dr. K. K. Agarwal's mission and vision of really, taking up these issues with children. We continue, of course, to do all the activities that he had initiated at the NGO, and we will continue to do so. All your support is greatly appreciated. Calling upon Shalini Arora ma'am, to please say a few words.
Thank you, Nana. Thank you very much. It's always a pleasure hosting talks by the Heart Care Foundation. We have been associated with the Heart Care Foundation for long, even before Dr. KK Agarwal started his series of talks on in the COVID era. It's been always a pleasure to communicate with him and to learn from a learned man like him. Even during the pandemic times, he was like a frontline warrior, leading us all from the front, elevating our mood, lightening our mood, telling us anecdotes, relieving us, clearing many myths in our minds about COVID. Sadly, he had to leave us, but thankfully to the Art Care Foundation for carrying the good work forward. And I am very happy that you are taking up topical causes and reasons, that we still feel connected and our parents feel the need that we still need to know. There are some queries that need to be solved that you cannot get all answers from each other or from Google. But if a learned person is sitting there, a specialist is sitting there and answering your queries in front of you, it is a very noble job, I feel. Thank you, Dr. Mazda Turrell, who is a practicing neurosurgeon at the prestigious Wockhardt Hospitals in South Mumbai. Sir is also an honorary assistant professor of neurosurgery at the Grant Medical College and JJ Group of Hospitals. Dr. Mazda specializes in the treatment of diseases of the brain and spine and advocates an approach to neurosurgery that is both balanced and aggressive. His prolific clinical research has garnered several academic accolades, both nationally and internationally, and has resulted in numerous publications in esteemed scientific journals. Dr. Turrell's practice style is hugely collaborative. He strongly believes that the incorporation of parents, their families, and the medical staff as members of his team allows patients the best possible outcome and the speediest recovery. Sir, we are very thankful to you for taking up this topic of spine care in children today. As Naina ji rightly pointed out, that we, in this homeschooling period, children are sitting just anywhere with bent backs, bent necks, and working on devices, laptops. So this is the most crucial time as ever that we need to address these issues, and the earliest that parents know about it, the better. Thank you so much, sir. Of course, for our moderator, Naina Agarwal Ahuja, who is a trustee of the Dr. KK's Heart Care Foundation. She is also the founder of Talking Point Communication, a leading integrated and PR communications agency in India, which serves clients across various industries. Thank you very much, Naina ji. And over to my co-hosts for taking the platform forward. Thank you very much.
Thank you so much, ma'am. Can I now invite Rajmi, ma'am, please?
My greetings to Ms. Naina Agarwal, Trustee Heart Care Foundation, and my co-host principals. It is such a pleasure to have amongst us today Dr. Mazda Turel, who is a spine surgeon. Dr. Mazda Turel completed his degree in medicine MBBS from Grant Medical College and Sir J.J. Groups of Hospitals in Mumbai, and went on to pursue his degree in neurosurgery from the prestigious Christian Medical College in Vellore. He is affiliated with a number of medical societies and also is a member of various medical councils. Dr. Turel has over 50 publications in peer-reviewed journals and books. We are glad that Dr. Mazda would help students and teachers of DAV Public School Rohini and the other co-host schools in addressing one of the most common complaints being faced by young students nowadays. Due to long stretched hours of digital exposure on online classes and with lack of exercise regime. I believe many of our students are facing issues like stiff back and back pain. Even teachers who are taking online classes, checking and evaluating assignments, and marking papers online have started lately complaining of back issues. We are hence, doctor, looking forward to some good remedies and lifestyle changes to overcome such issues in this very sought after session. Thank you so much.
Thank you so much, ma'am. Really a pleasure having you here. Can I now call Bhavna, ma'am?
Good afternoon and welcome everybody. Thank you so much, Naina ma'am, and all the co-hosts for conducting this session. Thank you for taking time, for all the audience for taking time to join here. And thank you so much, Dr. Mazda today. All co-hosts have already talked about him. But in layman's language, I would say that he is a specialist in the most important thing, brain and spine, which is very important. Even during this pandemic times that children are, they're sitting anywhere, they're studying, there is no particular exercise, nothing is happening. So it is very important that this topic has been taken, and I'm grateful to KK Foundation and Dr. Turel that they will enlighten the parents with what are the benefits or how to take care of your spine, because it is very important for our flexibility and overall health. So I would thank sir and everybody who has joined. And see, one thing what I feel is, in this negative pandemic time, one positive thing that has happened, that we are getting enlightened, we are getting knowledge from different personalities, eminent personalities, on various topics which we would never have been able to get. But with this platform, Zoom or webinars, parents sitting at home, they can increase their knowledge how they can take care of the children well, they can take care of themselves well. So this time has actually made everybody realize the importance of health. And thank you so much, KK Foundation, for taking such topics so that parents sitting at home, they can jot down points how they can take care of their health and the children, everybody around them. Thank you so much. Now I would ask Naina ma'am to continue the program. Thank you.
Thank you so much, ma'am. Thank you for joining us, and a big thank you to the entire audience I think there are 500 plus people who are very, very eager to hear you, Dr. Mazda. So I won't kind of, take any more time. Dr. Mazda, can I now call you forward, please?
Hi.
Right.
Thanks a lot for having me. It's such a pleasure. I've given so many talks during this pandemic. Never have I seen 500 people listening to any of my lectures. So I'm absolutely thrilled and delighted to be here to try and able to tell you guys what might be the best way forward to take care of your spine. Am I able to share my screen?
Yes, you should be able to. You have screen sharing rights.
It says only host. How do I do it? Okay, fine. All right, great. So I'm going to talk to you about taking care of the back, and you can see my presentation as well, right?
Yeah, we can see your presentation.
Okay,
Also,
you can-
to all the kids here, if anyone has any questions, if anyone has any comments, you want us to talk in English, Hindi mix, you have any sort of questions, please keep putting it in the chat box. I do just, Dr. Mazda, I think a mix of languages will also work because a lot of these kids have different kinds of questions. A lot of their parents are also sitting with them. They may have questions. So once you're done with the presentation, then we can get into the discussion on the questions.
Sure. So we'll first finish the talk and then we'll take questions.
Yes, yes.
Okay, that's great. So the spine is an extremely important organ. It's the extension of the brain, and a lot of people, we know that this pandemic has really brought a host of illnesses into the picture, and one of the commonest ones is spine problems. So for all the kids in the audience, does anybody know how many actually bones does the spinal column have? The spinal column, let me see if we, is the spinal column, which is right here in my hand, is made up of a series of bones, and there are 33 bones stacked on one on top of the other, and between these bones we have what is called as the intervertebral disc, which acts as a shock absorber. And it's the spine has 4-5 segments to it. You have a cervical segment, and then you have a thoracic segment, and then you have a lumbar segment and a sacral segment. So all these are particularly curved in a particular fashion to be able to give the spine its curvature and its balance and all of that. The spine is an extremely, extremely important organ, and most of these spine problems happen because of weak muscles. Understand that. It's not your bones that are weak, it's not the joints, it's not the ligaments, it's primarily the muscles. So for anyone having a spine problem, it's extremely imperative and extremely necessary that you all strengthen the muscles. Okay, so you can see the cervical spine, which is the neck, which is made up of seven vertebrae. Okay, and you can see that this has to be nicely aligned in one straight line. And the way to really take care, most of us are on the computer the whole day. Most of us are not not really in the correct posture. And I'm going to tell you how one actually can take care of their spine. So just to kickstart you, the one way to really make sure that your neck doesn't hurt is to do something called as isometric neck exercises. And what do isometric neck exercises mean? Means, you push your hand against your head and count till 10. There should be pressure, counter pressure. So it strengthens the neck over here. Push the head back against your hand and push, count till 10. So even between school, whenever you have breaks here, all the kids can do it. Push your head back against your hand and count till 10. Push your hand on one side like this and count till 10. Push your hand on the other side like this and count till 10. So in between class, if you all can just do this 3-4 times a day, maybe every 2 hours, just do it for about 1 minute. It's going to strengthen your neck muscles. And that's going to be the key to you being able to look at the computer. Even for teachers, anytime you have a break, it's very, very important that you are able to increase the tone of your muscles. The other really good exercise to do is to stretch your to stretch your neck out, and to prevent all these aches and pains is to be able to push your hands wide back, stretch your neck completely behind, as if you want your thumbs to touch one another, and you can do it 1, 2, 3, 4, 5, and that will stretch the whole upper spine out, and it will relax. So between every class, or between every period, you can take a 15-second break and just stretch out like this. Stretch your muscles. Stretching is the key, because remaining in any one position is what causes the muscles to go into spasm. You can see that the cervical spine is made up of very, very distinct vertebrae, and this actually spine is what carries the weight of the world. It carries the weight of your head. Your head is in a sense 2 to 3 kilos in weight, but we don't feel that weight, and it's because of the way the body is structured. So do the kids know how many, the giraffes have such a long neck, and human beings have seven vertebrae in their spine. Do you know how many vertebrae do giraffes have? How many? Anyone wants to answer can answer in the chat box. So the giraffes also surprisingly have 7 vertebrae in their neck. Correct. The guys who've answered 7 is correct. Even though it feels like they have many, many more, they actually have 7. I'm not able to. Oh. Is my screen gone off?
Yes,
Or is there?
it's gone off now. Yeah.
My screen's gone off?
Yes, it's gone off.
Okay. Now it's back?
Yeah.
So this is what a giraffe neck looks like. So while the humans on the right side, you can see this is how the vertebrae are stacked. The giraffe vertebrae look like this. So even they have 7 vertebrae in their neck. And then these are dinosaurs from which human beings have evolved, and this is what their skeletal structure looks like. So the human spine, you can see the human spine, mainly a spinal unit, is composed of 2 vertebrae, and in between we have this disc. This disc acts like a shock absorber and prevents all the wear and tear from happening. So when this disc degenerates, now it bulges into this foramen, and this foramen is from where the nerves come out. So when we have patients have sciatica, when they have pain going down the leg, or when they have pain going down the arm, it's because this disc compresses on the nerves. And the only way to prevent this from happening is by strengthening the muscles. If there's one take-home message, see, 99% of people who have spinal problems, they don't need surgery, especially children. They don't need surgery. The key is in maintaining your posture and in strengthening the tone of your muscles. So remember that. You can see this is a healthy disc above. This is a very healthy disc. It's nice and white. It's full of water. And as we age, with wear and tear, the disc degenerates. And when the disc degenerates, it pinches on the nerve that comes out from here. And that is why you have all these aches and pains. And this is the cross section of what the spinal cord looks like. The nerve comes out from here. It's a beautiful looking picture. Do you know that in the mornings, if you measure yourselves, all the children, if you'll measure yourselves in the mornings, you'll be 1 or 2 centimeters taller than what you are in the evenings. If you measure yourself early in the morning, the first thing when you wake up, and then you measure yourself the first thing in the last thing in the night before you go to sleep. In the night, you'll find yourself that you are slightly shorter. And why you're shorter? Because throughout the day, the disc spaces between the spinal column, these disc spaces, they desiccate, they start losing their water, and that's why they shrink a little. And throughout the night, they get time to get replenished, and they again absorb the water and are ready for the next day's work. So your whole body replenishes itself nicely. So it's extremely important that you all get a good night's sleep every night. Okay, you all should not be looking at your iPads, not be looking at the iPhone, not looking at any of the screens 1 hour, 2 hours before you go to sleep. and sleep for a nice 8-10 hours in the night undisturbed, and then you'll feel beautiful. You'll feel your back nice and fresh. So all these famous people, can you identify all these famous people? All these famous people have had spine surgery at some point of time in their lives. They've all had a spine operation because they've had immense amount of wear and tear in their spine. And you know, this gentleman, everyone, he's probably not from your era, but he was Superman to us in our time. And poor fellow, he had a very, very bad accident and he snapped his spinal cord, because of which he became paralyzed in his hands and legs and lived the rest of his life in a wheelchair. So if you want to prevent any damage to your spine, you have to really take care of your spine and your back, and you have to strengthen the muscles of your spine. This very famous movie star in our country also had a spine operation. And smoking is one of those things that really worsen spinal conditions. So if you or anyone you know smokes, then you should tell them not to, because it really causes the bones to degenerate very, very quickly. So I'm very quickly going to tell you what is the correct way to sit. So whenever you're sitting either in class, this is for teachers as well as for children, you should always make sure that you're sitting with your bum stuck in this right angle of the chair. There should not be any gap. You mustn't slouch into your chair. Most of us have a habit of slouching. Most of us, you should not slouch into your chair. You should push your bum into the right angle of the chair so that your back posture is maintained. Use a chair with a nice lumbar support if you need to, but always push yourself into the right angle of the chair. The other thing is that you should not sit in any one position for more than 1 hour. So teachers, I've noticed, I have two little beautiful daughters who are 5 and 7, and they do online school. So our school, every hour they give a break, or every 45 minutes, half an hour, you tell the children to get up, do a little jogging on the spot, or take a walk and come back, take a water break. The reason why this is important is because your back loves mobility. So anybody, spine problem, no spine problem, don't be in any one position for more than half an hour, 45 minutes. If you're sitting for half an hour, just stand up for 1 minute, change your position, and then you'll realize the difference that it makes to your spine. Similarly, when we're working on the laptop, we should make sure that the laptop is at eye level from us. And we should make sure it's at a distance of about 2 feet from our eyes. When we are sitting on a chair, we should ideally have some nice armrests, and our shoulders should be well relaxed. And we should have the ability to rest our arms on an armrest. And we should put a little kind of a 6-inch foot pad below, so that our knees are at right angles to our hips. This angle of the chair should be at right angle. So if you're able to maintain this nice posture, it's an ergonomically good posture for you to maintain. Then it's extremely important. And children, especially children, have very, very flexible spines. Children's bodies are very malleable. So children at a young age should start sitting correctly, because if you sit correctly, you'll be able to carry this forward into the future. Your body has memory, your spine has memory. So if as a child you're slouching and sitting, you'll grow up to slouch and sit. If as a child you're sitting upright, you will grow up and sit upright. Okay? If your children are going to do some form of exercise, any age, some form of yoga, every evening, if you just run around a little bit in the compound, in your house, wherever, garden, whatever it is, play is extremely important for children. And not playing on the phone, not playing on the screen, playing outside, playing with a ball, playing with a bat, doing some kind of sport, running around for 1 hour, 2 hours a day. Very, 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 very good for the back and for overall health. Now, supposing you're going to school, physical school has started for some people, and you need to tie shoelaces. If you have sometimes you have Velcro shoes. When you tie a shoelace, put your foot on the other knee and then tie the shoelace or strap your shoe. Don't bend down forward to tie your shoelace, because bending down forward causes a lot of strain on the back. So it's very important that that's the way you decide to tie your shoelace. And similarly, when you bend down, whenever you bend down, jab bhi aap bend hote ho, you bend from the knee and from the hip. Don't just bend from the spine. So if you bend from the knee and the hip, and if you have some kind of support, this is for anybody, not just children. This is for anybody. If you bend that way, then there's a great chance that you're going to prevent wear and tear on the spine. And similarly, when you lift something, जब भी आप कुछ भी चीज उठाते हो, उसको शरीर से दूर मत उठाओ, उसको शरीर के नजदीक लेके आओ और फिर उठाओ. अगर झुक के भी उठा रहे हो तो शरीर के नजदीक उठाओ. अगर हम दूर से उठाते हैं तो बैक के ऊपर अननेसेसरी अनड्यू स्ट्रेन आता है. Now, what is the correct way to lie down? So when we are lying down on the bed, we should ideally put a pillow below our knees. When we put a pillow below our knees, what happens is that the knees flex a little and it opens up the spinal canal. Okay, that's very important that we put a pillow below our knees. When we sleep, ideally, the way to sleep is on one side. And when we sleep on any one side, that realigns the spine nicely, and we can put a pillow between. We can pull up below between our knees, and that also helps significantly. Similarly, when you are getting out of bed, it's important that we use our hands to get out of bed. Okay, when we use our hands to get out of bed, first step is to put your legs down, turn onto one side, and use your hands to get out of bed. Don't use your spine to get out of bed. That is very, 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 very important. जब भी हम कार में बैठते हैं, हम ऐसे ही दरवाजा खोल के बैठ जाते हैं. बहुत जरूरी है कि हम बैठे, दोनों पैर के साथ बैठे और दोनों पैर को साथ में अंदर ले. और सिमिलरली जब हम उठ रहे हैं तो दोनों पैर को साथ में बाहर निकाल के उठे. That not only prevents wear and tear of the spine, it's good for the hips, it's good for the knees, it's good for all of those things. So that is extremely essential that this is the way you follow certain. Now, whenever you're doing some work in the house, you're, sitting in the kitchen, cooking, waiting for a microwave to heat something, you can try some basic just exercises, some lunges while you are there. Just strengthen your knee. When you're sitting and watching TV or sitting in class, you can just straighten your knee out, straighten your knee out to 90 degrees to the floor, parallel to the floor, and just hold it for 10 seconds. That will strengthen the muscles around your knee, your hamstrings, your quadriceps, and that will also be extremely helpful. So if you are constantly mobile, if you are constantly moving, you will prevent significant amount of wear and tear. Waiting in the kitchen for something to bake, something to heat, you can just do simple lunges, simple exercises, and especially for mummies, you're constantly running around, everything stiff. This will really help you. So I usually have a chart of simple back exercises, and if you all want, I can share that with all of you, and you all can circulate it, or you can take a screenshot of this. But the chart is a little more exhaustive. When you want to get out of bed now, you can just put your knee into your chest before you get out of bed in the morning. Put your knee into your chest for 10 seconds, one at a time, and that actually really stretches out all the back muscles very nicely and very strongly. And if you do a basic set of back exercises, back strengthening exercises, core strengthening exercises, it makes a huge difference to people. If you have to make sure that you don't do any of these funny things, because any of these acrobats can significantly damage your spine. So make sure to be perfectly well taking care of your stuff. And then the neck. We have a lot of these pathological problems. A lot of people, we hear of what we call a slip disc, but it's not only slip disc that causes neck pain. Sometimes, you can have TB of the spine. Sometimes you can have tumors of the spine. So you have to be very careful. Now, all of us are on WhatsApp the whole day. We can't stay without it. All our information comes from there. And, looking at the phone for half an hour is like putting a 30-kilo weight on your head. So that causes, again, be on the phone for as little as possible. Do it only when it's necessary. When you preferably try and use it at eye level. I know it's a challenge, it's difficult, but try and do that. And like I explained to you, don't forget to do these exercises on a regular basis. push your hand against your head. This is just the basic stuff. If you can do this, and I'll send you a chart of exercises, that will also help. But supposing you have neck pain that's going down your arm, or you have severe tenderness when you press the neck and you wince in pain, or you have restriction of neck movement, then you mustn't take it down lightly, and you must show a physician or a surgeon or any kind of doctor. Sometimes children have start developing deformities. This is a child who came to us. We see such a bad deformity of his spine, and eventually he needed a big operation. He had some scoliosis, and we fixed it. Sometimes elderly people, you can see this lady finding it so difficult to walk. She's overweight and she is bent forward. She finds it really hard to walk, not getting better with medication, physiotherapy, exercise, etc. And some of these patients really benefit from surgery, but we keep surgery as the last resort to patients who've tried everything else. And
get up from the chair, lean forward, put weight on the legs, and stand up straight. Yes.
Whole
Now,
aim is to prevent an operation. You can see how this guy was walking before an operation, and you can see how much better he's become after an operation. So surgery is really reserved for a very, very specific subsection of patients. It's also important that your bone health is maintained. So children have to have good nutrition. They have to have overall good nutrition. So you have to have in moderation everything. You have your sweets and desserts in moderation, have your milk in moderation, have your fruits and vegetables in moderation, eat a balanced diet, and make sure calcium and vitamin D levels are okay. For the adults, we don't get a lot of calcium and vitamin D in our diet, and that is why sometimes you might have to take supplemental calcium. So check your vitamin D levels. That's very important, because vitamin D3 deficiency causes a lot of aches and pains in the body, and if it's not optimized, then you can optimize it by taking this medication. So everybody, whether you're young or old, being out in the sun, half an hour a day is great for your spine. Constantly being mobile is great for your spine. Getting involved in any kind of sport, cycling, swimming, etc., is exceptional for your spine. Don't sit for more than 30 minutes at a stretch, and wherever you can, try and be mobile. If you need to go to the corner store, don't take the car for a 2-minute drive. Try and walk there. Don't use the elevator when you can use the stairs. Basically, simple rules, and good things are going to happen. All your aches and pains are going to go away, and you're all going to be happy, healthy children and adults. So if you have any questions, you can all take down my email address. You can even take down my mobile number and send me a WhatsApp message, and I can reply to it if you have any problems. A lot of this information is also available on the website, which is my website, and you'll have a lot of spine related issues that if you want to discuss, I'll be happy to discuss with you. If you have any questions,
thank you. I think that was very, very insightful. I can see a lot of people have raised their hands, so maybe I'll take each one of them. And also,
will you ask the questions, because I suddenly see like 600 questions in the chat, so I'm not able to.
The chat box is also some insignificant chat. I will just take the questions one by one, and then also have our co-hosts ask their questions, because all the principals often get questions from their own parents and schools in advance as well. So I'll just, maybe I'll start with some of the people who've raised their hands. Paridhi, can you unmute yourself and ask your question? You would get a prompt. Yeah. Paridhi, you had a question.
मैम सर मेरे ना बैक में पेन होता है जब भी मैं उठती हूँ, और मेरी नेक में भी पेन होता है.
आपकी एज कितनी है?
पारिदी म्यूट हो गया.
8 years old.
हाँ, तो बहुत ही जरूरी है कि आप कुछ एक्टिविटी में इन्वॉल्व हो जाए. जैसे हमने बताया, ये जो बैक के स्ट्रेचेस है वो आपको करने हैं. ठीक है, जब भी आप बेड में से उठते हो तो घुटन को लेके चेस्ट में डाल के 10 तक गिनो दोनों साइड में. ओके, वो उससे बैक का पेन कम होगा। और गर्दन के लिए दोनों हाथ को लेके ऐसे पीछे स्ट्रेच करो और गर्दन को एकदम ऊपर ले लो, उसको अच्छी तरह से ऐसे स्ट्रेच करो। और फिर जैसे हमने बताया ये एक्सरसाइज करना है गर्दन के लिए, तो उससे आपके जो गर्दन के मसल्स, ये जो एक्स और पेन्स होते हैं वो सिर्फ वीक मसल्स की वजह से होते हैं और कोई कारण नहीं है। और अगर हम मसल्स को स्ट्रॉन्ग करेंगे तो आपका ये जो पेन है वो धीरे धीरे कम हो जाएगा।
विहान कुमार, विहान आपका क्या क्वेश्चन है? विहान अनम्यूट करो।
यस मैम। मैम मैं तब कभी कभार मैं चेयर में बैठता हूँ तभी भी मेरा थोड़ा बेंड हो जाता है, मैं खुद ही बेंड हो जाता हूँ, मैं पोजीशन में थोड़ा खुद ही बेंड हो जाता हूँ। मेरे पहले तो मैं स्ट्रेट रहता था स्कूल्स में, तो अब ऑफलाइन क्लासेस में तो ऑनलाइन क्लासेस में थोड़ा मैं बेंड होने हो तो
वही उसका आंसर एक ही है कि आपको आपके मसल्स को स्ट्रॉन्ग करना पड़ेगा। बीच में अगर आप बेंड होते हो तो बच्चों लोग के लिए या बड़े लोग के लिए एक पोस्चर करेक्टर करके आता है जो पहन सकते हैं, ऐसे दिखता है। it's like a strap that you can wear on. This is a posture corrector. It's called a posture corrector. It's available at every pharmacy stall. You can just put it on like this. It's like wearing a school bag. You can put it on like this and strap it like this. So that way you will not tend to fall backwards. Your spine will be straight and it will be upright. तो इसको ऐसे कोई भी केमिस्ट के पास से खरीदो, पोस्चर करेक्टर बोलते हैं इसको, और इससे आपका पोस्चर ठीक रहेगा। दिन में 3-4 घंटे के लिए पहनो, अगर स्कूल कर रहे हो तो उस टाइम पे पहनो, तो उससे आपका पोस्चर मेंटेन रहेगा। पूरे दिन पहनने की जरूरत नहीं है, जब भी आपको लगता है कि आप ऐसे झुक रहे हो तो वो आपके लिए अच्छा रहेगा। ठीक है?
ओके सर, थैंक यू सर।
प्रांजल।
Yes, ma'am. I have a question for you. That what is the weakest and what is the strongest part of the spine?
So there's no such thing as the weakest and the strongest part. The sturdiest part of the spine is the lumbar spine, which is the lower spine, and the most mobile part of the spine is the cervical spine. The most rigid part of the spine is the thoracic spine, which is in between because it's covered by the rib cage. So being the most mobile part of the spine is more subject to wear and tear than neck part of the spine. So you have to be careful. We can't call it the weakest part or the strongest part, but we can call it the most mobile and the most non-mobile part. But overall, the whole spine in all its segments is very, very essential.
Pratyush Arora.
Yes, ma'am.
Pratyush, म्यूट पे हो आप।
Ma'am, I have a doubt that what is the average height of human adult spine?
Okay, we will have Dr. Mazda address it in 1 second. जिन जिन की क्वेश्चन है आप या तो चैट बॉक्स में डाल दीजिए क्वेश्चन, या यू कैन रेज योर हैंड एंड वी विल टेक यू वन बाय वन।
Sorry. No, tell me.
Pratyush was asking. Pratyush, your question again, please.
Ma'am, my question is that what is the average height of a normal human adult? What is the average height of a normal human adult spine?
Dr. Mazda, he wants to know what is the length of an average human adult spine?
I mean, it's very difficult to. It depends on it just depends on the height of the person, but I'm guessing it should be about 2 feet, 2.5 feet. We can Google it and check.
Rojal, what is your question? You can
Ma'am,
say.
my mother has also this back problem.
Okay. Is your mother around? Does she have a question?
Ma'am, yes.
You want to ask her question? What problem she has? You want to
Ye-
call her?
Yes, ma'am.
Yeah, call her. Digvi, Tanya, you have a question?
मैम मेरे लेग में पेन होता है और हेड में.
लेग में पेन होता है और हेड में पेन होता है.
यस
कौन से, दोनों लेग में होता है कि एक ही लेग में होता है?
सर, दोनों में.
दूध पीते हो अच्छे से?
मैम सर, चौकोस का तो मिल्क भी पीती हूँ.
हाँ, चौकोज मत खाओ, आप दूध पियो और फ्रूट्स और वेजिटेबल्स खाओ. उससे हेडेक भी कम हो जाएगा और लेग पेन भी कम हो जाएगा.
ओके.
फ्रूट्स और वेजिटेबल्स खाना है सबको. चॉकलेट
Thank you.
बहुत कम खाना है. चॉकलेट से
Okay.
बोन सॉफ्ट हो जाते हैं.
थैंक यू सर.
रोजल, आपकी मदर आ गई?
यस मैम. हेलो.
हाँ जी, नमस्ते.
नमस्ते जी. गुड इवनिंग मैम.
गुड इवनिंग.
मैम मेरे को काफी टाइम से बैक प्रॉब्लम है.
क्या प्रॉब्लम हो रही है?
मैम बैक में मेरे को बहुत पेन होता है. मैं बैठ के जैसे कोई काम नहीं कर सकती.
तो देखना पड़ेगा कि बैक पेन किस वजह से है. मोस्टली पुअर पोस्चर की वजह से ही है और वीक मसल्स की वजह से है. तो अगर आप कुछ तरीके की फिजियोथेरेपी कर सकते हो, कुछ तरह के एक्सरसाइजेस कर सकते हो, उससे 90% चांस है कि आपका पेन चला जाएगा. जैसे हमने बताया, आधे घंटे से ज्यादा बैठो मत. हर आधे घंटे में पोजीशन चेंज करो. हमने आपको सोने का, बैठने का तरीका बताया है, वो आप अगर फॉलो करेंगे तो उससे आपको डेफिनेटली बहुत फायदा होगा. और कुछ 10-15 मिनट के लिए बैक स्ट्रेंथनिंग एक्सरसाइजेस करेंगे तो उससे आपको बहुत फायदा होगा.
ठीक है सर. थैंक यू सर.
Harit?
Excuse me, ma'am. I have a question.
Yes.
मेरे को बैक में और इस तरह से तो नहीं, लेकिन लेग्स में और हैंड्स में कभी भी किसी भी टाइम पेन होना स्टार्ट हो जाता है. और ये प्रॉब्लम तब से कोविड स्टार्ट हुआ है तब से हुआ है, क्योंकि मेरा सिटिंग टाइम बहुत ज्यादा. टीचर हूँ और बच्चों के साथ भी उनको पढ़ाना पड़ता है. तो प्रॉब्लम क्या है और क्या सोल्यूशन है?
क्या ये मल्टीपल एक्स एंड पेन बहुत सारी वजह से हो सकते हैं. वन प्रॉब्लम इज डेफिशिएंसी ऑफ विटामिन D3 एंड विटामिन B12. वो आप अपने D3 और B12 को चेक करो. और अगर वो लेवल्स ठीक नहीं है तो उसके सप्लीमेंट लेके उसको ऑप्टिमाइज करो. दूसरी चीज है कि अलग, जैसे हमने बताया, ये जो पोस्चर्स है उसके ऊपर ध्यान दो और मसल्स को स्ट्रॉन्ग करने का ध्यान दो.
पोस्चर तो हमेशा ही ठीक रहता. मैं तो बच्चों को भी बोलती हूँ बिल्कुल स्ट्रेट बैठो और प्रॉपर वे चेयर टेबल लेके बैठो. लेकिन मेरे को ऐसा नहीं है कि रूटीन में हो रहा है. कभी कहीं पे भी हो जाता है. आज पैर में हो रहा है तो ठीक है, 2 दिन बाद वो ठीक हो जाएगा. फिर हाथ में कभी हो जाएगा, कभी कहीं हो जाएगा. मतलब ऐसा नहीं है कि कंटिन्यूटी में चल रहा है और कंटिन्यूटी में पेन हो रहा है. मतलब रीजन नहीं पता, अपने आप ठीक हो रहा है, अपने आप स्टार्ट हो जा रहा है.
विटामिन D3 और B12 चेक करो.
ओके.
अगर वो लो है तो उसको सप्लीमेंट करो जैसे हमने बताया है वैसे.
थैंक यू.
Shalini ma'am, Rajbir ma'am, Bhavna ma'am, do you have any questions? Since there are a lot of kids also, but I would open the questions to all of you.
Nana, I would like to ask Dr. Mazda, is there any one simplest, easiest way for all the age groups, right from the class 1 student to someone aged around, say, 60 to 70 years, some very easy basic exercise which one can motivate oneself always to have oneself in fit and perfect posture? Something one can, engage in without any extra effort.
So nothing good comes easy, madam.
I understand. Absolutely, this was there in my mind, sir. But
still, like I told
yeah.
you, the easy method for strengthening the neck muscles is very simple by doing just isometric neck exercises. That is why I have only shown the easy thing.
Yeah, they are
And by
wonderful.
doing
Yeah.
stretch.
Hmm.
And for the lower back, the exercise to do is to put your knees into your chest one at a time, like this, when you're lying down, and count till 10. And that elevates, removes any kind of spasm from the. So if you can do these two exercises, they will really make a big difference to your
Definitely.
neck and your lumbar spine, which are the commonest issues of concern in most people.
Right, sir. I think, and they are very easy to do also.
They are very easy, very simple. You can
Yes.
do it while you are indulging in any kind of activity also. You don't have to specifically dedicate any time to it. So it's great.
And another thing is, I think the kids nowadays, they need to motivate themselves to always be seated at the right places in the right posture. And they need to self-correct themselves, and we need to correct them as well.
Yeah,
So
no, it's a tough job for teachers to monitor so many kids at one time. And what you teachers are doing is exceptional. It's unbelievable how you have adapted to the changing nature of this pandemic, online, offline, hybrid. What you all are doing, I don't think anybody else is capable of doing. And really, my hat's off to all of you.
Thank you, sir, for acknowledging it. And there is no doubt about it.
I salute you and have the highest regard and respect for teachers. They're just doing an unbelievable job.
Thank you.
I'm very proud of you all.
Thanks.
Thank you, ma'am. Shalini, ma'am, do you have any questions? Bhavna, ma'am, Shalini, ma'am, before we go on to the students.
One thing I want to ask, should we give small kids like 2+ these calcium or vitamin D supplements, irrespective of the whether they have low vitamin D levels or no?
I mean, they don't harm if they're not overdosed. You know, there are these vitamin D drops that are available. If you just give 1 or 2 drops a day, there's no harm in that. Usually, it's actually good to give it, because kids, you know, nowadays,
how much time can we give?
You can give it, you can give it for a month, then take a break for a couple of months, then again give it for a month.
Okay.
That kind of stuff can be followed, because children nowadays, I mean, their diets are changing. Every household has a different.
Even things are not pure, which they are consuming.
Correct. So you can, and it will help. It's not going to harm unless you overdose, and I don't think that much causes any overdose.
Okay. Thank you so much, sir.
Jyotishta, you have a question?
Yes, sir. My question is, what is the best diet that we can take to keep our spine healthy?
So the best diet is always a balanced diet. I'm not a proponent of don't do this, don't do that, don't cut off completely anything. No, you have to have everything in proportion. You have to have a good mix of fruits and vegetables. That should be the key in your diet. I'm not saying don't eat chocolate, don't eat ice cream, have all of that, but have it in a very, very moderate, though. You can have it once a week, maybe twice a week, one of those things, but don't make that your main thing. Fruits, green leafy vegetables, fruits. If you're vegetarian, that's also fine. If you're non-vegetarian, that's also fine. Just eat a healthy mix of everything in the correct proportion, and don't overdo any one particular thing. That's going to, not only for your spine, but for your general health, that's going to avoid refined sugar, because that we know is really bad. I know it's difficult for children. Even I find it hard to stay away from chocolates, but try and avoid it as far as possible. I mean, it's the correct thing to do.
Ira, your question, please.
Yes, ma'am. Ma'am, when I will sit without my pillow, my back is paining.
So use your pillow. That's okay. Use your pillow to support your back. Not a problem.
No,
but
every time my back is paining without pillow.
Yeah, so the key is you have weak muscles, so you have to strengthen those muscles. That's the most important thing.
Okay. Thank you, sir.
Strengthen the muscles.
Harshit, your question.
My name is Manvi. मैम माय क्वेरी इज जब मैं स्टडी करती हूँ, जब मैं नीचे झुकती हूँ तो मैम मेरे बैक नेक में बहुत पेन होता है। एंड मैम सर ऐसा करती हूँ तो मैम सर यहाँ पर भी होता है।
तो वही है, आपको एक्सरसाइज करनी है बैक के लिए। आधे घंटे से ज्यादा बैठो मत एक पोजीशन में, और अगर आप झुक रहे हो और दर्द होता है तो वो पोस्चर करेक्टर लेके आओ और उसको पहनो, ताकि आपके शोल्डर्स ऑलवेज पीछे रोल्ड होंगे और झुकने से आपको इतना दर्द नहीं होगा।
सर मैं झुकी जाती हूँ खुद ही।
तो वही टेम्परेली जब तक आपके मसल स्ट्रांग नहीं होते हैं तो वो एक पोस्चर करेक्टर जो हमने आपको दिखाया वो पहन सकते हो।
ओके, थैंक यू सर।
Ayushi.
Good evening, ma'am and respected sir. I have so many doubts, so please don't mute me, ma'am. Yes, my first doubt is that every time when sir, आप मेरे को एक solution बताओ, because on table I can't take classes because my sister is small and she is having an eye problem. So it is important for her to take class. It is important for her to take class on table. So I always sit on bed, and right now I'm taking my class on bed, sitting on bed. So my doubt is that what can I do to maintain my posture?
So if you are sitting on the ideal thing would be to just get another simple table and chair next to your sister's table, or in another
There
room.
are both voices merge and her concentration becomes break.
Sit in another room, sit in the room that you have, you get a small table and chair. You don't have to sit on the bed. So that is a small investment you need to make for your spine. The bed is only supposed to be used to sleep. All your other activities should be done on outside of the bed. Supposing you're forced to use the bed, then ideally you can take a support and put something below, like a pillow, and sit against the bed. But I would still recommend strongly that you get a table and chair for yourself.
And next question, sir, I am having that when I started my exercise, when I started doing exercise and I saw that I am having obesity, so I started to do exercise. And for a few days, I started having neck pain, so I stopped it.
Okay.
So what to do? I want to do exercise.
So continue exercise, continue the correct exercise. The one important thing, you can start slow. Don't start vigorously. Start slow with walking. Walk for about 20 minutes a day, and then slowly increase it to 25 minutes, then 30 minutes.
I do after eating dinner.
Yeah, very good. So continue that, and that will take care. And for your neck, you do these isometric exercises that I showed you.
And sir, I am having an extra related doubt, not related to this topic. Can I ask to you?
Of course.
Yes, I have two doubts. First one is that when I take classes, my eyes are having no problem. My eyes are very healthy. But after some time, I started having watery eyes. अगर water ही नहीं होती है तो मैं मतलब concentrate नहीं कर पाती हूँ मैम की तरफ, मैं देख नहीं पाती, और लैपटॉप की brightness में एकदम 0 कर देती हूँ, फिर भी मैं नहीं देख पाती.
So abhi, you get these glasses which are screen sensitive glasses for eyes. There are special glasses that are available that don't.
How can I buy them?
I think they're available on Amazon. If you ask your mommy, she'll be able to get, mommy or daddy, they'll be able to get it for you. They are just filter glasses that don't have no color, but they can reduce the stress that's coming from the rays, reduce the light coming from the screen, and they are very helpful. Or your screen can also have a filter which reduces the stress that comes on your eye.
And if I go to a shop, so how can I ask?
If you look at it on Amazon, or you get an eye doctor will be able to tell you exactly what the correct thing available is, because a lot of these things are available now for children for eye issues.
And sir, the last one is that my father has bought a copper jug and a copper glass for me on my demand. I really want to drink copper water. So I searched on YouTube that is copper water healthy? What should we drink in copper or vessel or not? So it was showing so many results, so many. So can you tell me the exact one?
It's healthy. You can drink in it, no problem.
Only water?
Anything you want, you can drink it.
Milk?
Yeah.
Actually, you can have whatever you want. Now we'll move on to the next question. Thank you.
Okay.
Yes, Toyesh.
Thank you, sir.
यस सर, माय फर्स्ट डाउट is सर मेरी हाइट ग्रो नहीं करती मैं सर।
क्या हाइट?
सर मेरी हाइट ग्रो नहीं करती सर।
हाइट ग्रो नहीं करती है, वो एक हेरिडिटरी इशू है। उसकी आप ज्यादा फिक्र मत करो, जो आपकी हाइट है उससे आप काम चलाओ। हाइट ग्रो करने की जरूरत नहीं है, जैसे आप ग्रो हो रहे हो वो ठीक है। ठीक है, आप एक्सरसाइज पे ध्यान दो। आप पुल अप बार्स पे स्ट्रेच कर सकते हो अगर आप स्ट्रेच करना चाहते हो तो, लेकिन वो आपके कंट्रोल में नहीं है आप कितने लंबे या कितने शॉर्ट है। वो आपकी पैदाइशी है, वो आपकी जीन्स में है। उसको चेंज करने की कोशिश मत करो, जो आप है उससे आप उसको आप इम्प्रूव करो।
यस सर, और मैम मेरी ग्रैंड मदर है सर, उन्हें भी एक दिक्कत होती है सर, कैन यू।
नमस्ते माँ जी।
हाथों में चीज होती है मेरे इनमें, सुन पर
हाथों में,
इन उंगलियों में ना सुन रहती हैं।
होता है। तो सुनापन बहुत सारी चीज कारण की वजह से हो सकता है। एक तो डायबिटीज अगर है आपको तो उसकी वजह से हो सकता है।
वो नहीं है।
विटामिन B12 की डेफिशिएंसी की वजह से हो सकता है, उसको थोड़ा चेकअप करना चाहिए। या गर्दन की नस के ऊपर दबाव होने से हो सकता है। वो ये देखने के लिए मोस्टली ऐसी चीज जानने के लिए तपास करना पड़ता है पेशेंट का, और फिर हम बता सकते हैं एग्जैक्टली कि क्या इश्यू है। पर टेम्पररली एक बेसिक ब्लड प्रोफाइल करके देखिए कि आपकी विटामिन D3 B12 वो ठीक है। अगर वो ठीक नहीं है तो उसकी आप थोड़ी सप्लीमेंट ले सकते हैं। और
विटामिन D3 की टेबलेट मैं रोजाना ले रही हूँ।
और B12
वो नहीं।
आप वेजिटेरियन हो?
हाँ जी।
हाँ, तो यूजुअली वेजिटेरियन लोगों में B12 की कमी होती है और उसकी वजह से हाथ पैर में झिनझिन ज्यादा होती है। तो एक तो बार आप
दर्द होता है,
तो वो आर्थराइटिस की वजह से भी हो सकता है। उनको उसको थोड़ा देखना पड़ेगा, तपासना पड़ेगा, और फिर हम बता सकते हैं एग्जैक्टली कि क्या इश्यू है उसका। पर तब तक एटलीस्ट टेम्पररीली आप B12 की एक टेस्ट करवा लीजिए। B12 विटामिन B12।
विटामिन डी, ठीक है।
एंड सर मेरी चाची जी हैं सर, उन्हें भी दिक्कत है।
नमस्ते सर।
नमस्ते
सर, मेरे है ना घुटनों में बहुत पेन रहता है, जीने उतरते चढ़ते दर्द होता है।
तो वो मेनली क्या है, घुटनों के आजू बाजू जो मसल्स है ना वो वीक है, तो उसको स्ट्रॉन्ग करना है। और उसके लिए घुटने की थोड़ी एक्सरसाइजेज होती है। जैसे हम ऐसे चेयर पे बैठे हैं तो घुटन को सीधा करके उसको पकड़ के 10 तक गिनो, और दिन में 3-4 बार करो दोनों घुटनों को, उससे मसल स्ट्रांग होंगे घुटनों के। ये उम्र में आपको घुटने की दर्द होने की कोई जरूरत नहीं है। तो मेनली अगर आप इसके मसल स्ट्रांग करेंगे तो आपका दर्द चला जाएगा।
ओके सर, थैंक यू।
थैंक यू तोयेश। पलक।
Good evening, sir and ma'am. Ma'am, I want to ask that my father is usually having a lot of back pain.
So we will have to see what is the cause of his back pain. We'll have to examine him and see whether it's only back pain or leg pain, but mostly it's probably related to posture and weak muscles. That is in 95% of the people, that is the cause of back and leg pain. So if you ask him, you teach him how to sit after what you've learned today, and you teach him the exercises, ask him to do it for 2 weeks and see if he feels better. If he doesn't feel better, you ask him to come and see me.
Yeah. Thank you, Palak. Can we take the last question? I think there's still 50 hands which have been raised, so I don't think we can accommodate everyone's questions, but I'm just going to take one last question. Ritika, what is your question?
My question is, मेरी ग्रैंडमदर है, उनके सर्वाइकल है और उनके डायबिटीज है, तो क्या कर सकते हैं?
देखो, ऐसे ये तो काफी वेग क्वेश्चन है कि क्या कर सकते हैं। उनको देखना पड़ेगा कि एग्जैक्टली क्या तकलीफ है, क्योंकि सर्वाइकल है मतलब सर्वाइकल की वजह से बहुत सारी तकलीफ हो सकती है, डायबिटीज की वजह से बहुत सारी तकलीफ होती है। तो अगर उनको हम देख सकते हैं, तपा सकते हैं, तो हम उनको कुछ सलाह दे सकते हैं। ऐसे ही बोलना, पर जितना जो भी तकलीफ हो, एक्सरसाइज से, वॉकिंग से, करेक्ट डाइट से काफी सारी हद तक उनको फायदा पहुंचेगा। तो जो भी आपने आज सीखा है सुनने के बाद, वो आप उनको बताओ और देखो कि उससे उनको फायदा होता है कि नहीं। अगर नहीं होता है तो फिर उनको बोलो हमको।
मैम मेरा चश्मा चढ़ा हुआ है, तो जब मैं ऑनलाइन क्लास लेती हूँ तो कभी कभी मेरी आई में पेन होता है, तो मैं ब्राइटनेस भी लॉक कर देती हूँ। तो फिर ये
मुझे ठीक से समझ में नहीं आ रहा है, लेकिन ऐसे लग रहा है कि आपको स्क्रीन देखने से आंख में थोड़ी तकलीफ हो रही है। तो स्क्रीन के लिए आजकल फिल्टर आते हैं काफी जो आई का स्ट्रेन रिड्यूस करते हैं, तो वो आप फिल्टर खरीदे और आपके स्क्रीन के ऊपर लगाए।
यस ओके।
I think any of my co-hosts have any questions, and then we can then end the session. जिन को questions अभी भी हैं, जिनको डॉक्टर टुरेल का कंसल्टेशन चाहिए, वो ऑलरेडी आपको अपनी डिटेल्स शेयर कर चुके हैं. I know lots of people still have questions. Maybe we will request Dr. Turel to come back for another session sometime in the future.
Sure,
I think it's been an extremely engaging session. I don't think I've seen 550 engaged children sitting there. And it's great to see how concerned they are about their posture and their spine. I think that's half the battle won at an early stage, if they are at least thinking about it, right? That I need to fix my posture.
Yes, no, it's great.
So any of my co-hosts, Shalini ma'am, do you have any questions? Rajbir ma'am, do you have any questions? Bhavna ma'am, do you have any questions before I ask Rajbir ma'am to close the session?
So many of the queries have already been answered in such a wonderful manner. So many of the queries, I think, and questions we have got brilliant answers to them. No questions as of now.
Sure. So yes, over to you. To kind of anyone else, Shalini ma'am. I think I didn't hear from you. Okay, Rajbir ma'am, then over to you to close the session, please.
Yes. With all the gratitude and humility, I, along with the team of teachers, students, and parents of DAV Public School Rohini, Delhi, DAV Public School Vikaspuri, Delhi, and Little Flower International School, Delhi, and along with my esteemed co-host principals, Mrs. Shalini Arora and Mrs. Bhavna Arora, want to thank Dr. Mazda Kurel for your worthy and valuable inputs on the most wanting issue of awareness in these times of pandemic, when most of us need to spend hours in front of our laptops, mobile phones, and other digital media. I'm also thankful to Mrs. Naina Agarwal for bringing out such an important and meaningful webinar and making us interact with such brilliant healthcare professionals, and for being such an excellent moderator. Once again, heartiest thanks, Dr. Mazda, for taking precious time out of your busy schedule and enlightening us to understand the science behind the functionality of spine and suggesting us great, easy to do home exercises. We are sure it will definitely bring about some awesome changes in our lifestyles and make us more active and better our postures over a period of time. Thank you all so very much. Good day.
Thank you so much. It's my pleasure entirely.
Thank you so much, doctor. Thank you so much, ma'am. Thank you.
Bye-bye.